Everything that we do starts with original Medicare. That is the foundation of Medicare, and everything we talk about is going to be built around that. So when I say original Medicare, really what I mean by that is there is Part A and there is Part B. So those are the two main parts when it comes to Medicare and your Medicare coverage. So Part A is what you have paid into your whole life. So as long as you've paid into, you or your spouse paid into Part A for 10 years or 40 quarters, Part A will be no cost to you. Now, Part B is your medical coverage, or I always like to really think of that as outpatient coverage. So think of doctors, MRIs, x-rays, CAT scans, any kind of outpatient service is going to fall under Part B. And super important here, this does have a monthly premium that everybody has to pay. And the standard monthly premium for that is $202.90. And if you are a higher income household, you will have an increased premium for that. They do take that into account. And if you kind of fall into that category, or you think you may fall under that category, again, there is a link to schedule a free one-on-one consultation to really look at your situation and see how we can best get that under control. So that is the foundation of Medicare. Now, when we think of original Medicare enrollment scenarios, there's really three main scenarios that are very popular. And if you're watching right now, you should identify with one of these three scenarios. Okay? The first one is the most common, and that is if you're drawing Social Security benefits before your 65th birthday. We're gonna go over each scenario here in a little bit more detail, but scenario number two is if you are not receiving Social Security benefits before your 65th birthday. And then scenario number three is if you are still working and have some form of employer-sponsored health coverage. Those are the three things, so let's get into each scenario here. Number one scenario, this is the most common, and that is if you're drawing Social Security before your birthday, you will automatically be enrolled into both Parts A and Parts B, and you will receive your Medicare card, your red, white, and blue card about 3 months before your birth month, and that's gonna have your name, an 11-digit Medicare number, and it'll have a Part A date and a Part B date. That $202.90, that monthly premium we were just talking about, that is gonna come right out of your Social Security check starting the month of your 65th birthday. So that's number one. Number two is if you are not drawing Social Security before your birthday, it's a very similar scenario. You just have an extra step that you need to sign up for Medicare on your own. And the best way to do that is through Social Security. You can do it online at ssa.gov. You can call Social Security, or you can make an appointment with your local office. Now, the big thing to be aware of is when you are not drawing Social Security, you will have to pay your Part B premium quarterly. So the first bill has to be quarterly. This year, that's gonna be $608.70. And once you make that first quarterly payment, you can actually make an account online at medicare.gov and get that switched over to an automatic monthly payment, okay? Scenario number three, again, a very, very common scenario right now is if you are working and still have some form of employer-sponsored health coverage, you really have two options here. You can delay Medicare if you have what's called creditable coverage through Medicare, or you have the option to actually sign up for Part A and Part B and move over to your Medicare health insurance. So if you fall under this scenario, go ahead and click the link below to schedule a one-on-one. It's always a good idea to compare your coverage, your cost, and see what's gonna be the best route for you, and ultimately make sure to avoid any penalties. So those are the three main enrollment scenarios when it comes to Medicare. The biggest thing is your coverage is going to begin on the first day of your birth month. Now, the only time this doesn't happen is if your birthday is on the first of the month, it's actually going to start the month before. So my birthday is September 12th, so my Medicare would start on September 1st. But if my birthday was September 1st, it's going to start on August 1st. Now, how does original Medicare actually work? So we talked about the cost a little bit, but what does the coverage actually look like? So we're gonna start here with Part A. And the biggest thing you need to be aware of is there is a $1,736 hospital deductible, and that actually resets every 60 days. Okay, and then there's additional co-pays and co-insurance after a certain amount of days in the hospital. So that is a huge exposure when it comes to hospital coverage, inpatient coverage with Part A. Part B, there's an annual deductible. This year in 2026, it's $283. And then once you reach that, you have the 80-20 split that everybody thinks about with Medicare. Medicare covers 80%. You're left with 20%. And the biggest thing you need to be aware of is there is no limit on the out-of-pocket expenses that you could have when it comes to your healthcare expenses. And then there's what's called Part B excess charges. These are super, super rare. Essentially, if a provider or a hospital system doesn't accept Medicare assignment, they could bill you an additional 15%. Again, super rare, about less than 4% of providers in the country charge that, but it is something that you need to be aware of. So a big reason you guys may be logging on today is how do we fix those big exposures when it comes to Medicare? The big hospital deductible, the 80-20 split with no limit. And this is where Medicare supplements versus Medicare Advantage really come into play. What are the pros and cons of each? And how do they each work? And again, my goal is not to sway you one way or the other, but to really give you the information that you need to make a logical decision based off of your unique situation. And again, everything really determines, everyone has a different situation. I always say Medicare is not a one size fits all. So if you see, several doctors maybe take different prescriptions, make sure to go ahead and click that link and really get a one-on-one consultation to really dive into your specific situation here. So Medicare, original Medicare and Medicare supplements, this is going to be the #1 way to get your healthcare coverage through Medicare. And again, original Medicare, think of this as your cards here. So Part A, Part B, that's your Medicare card. And then you have the option to add a Medigap plan, which is also known as a Medicare supplement. It is the exact same thing, just two different terms for that. And then additionally, you will need to add a separate prescription drug plan or a Part D card. So you're gonna have one card there, and a separate card for your prescription drug plan. So that is your first option when it comes to Medicare coverage. The second option is what's called Medicare Advantage, also known as Part C. And we're gonna dive into both of these options here in a second. But really what this does is this combines, a private insurance company combines your Part A, your Part B, and in most cases, they add prescription drug coverage to that. So all of your coverage is on one card with one company, and that company now manages your Medicare. And again, we're gonna dive into both of these in a little bit more detail here. So we're gonna start with Medicare supplements. Again, this is going to be the #1 way to get your coverage when it comes to Medicare. So the biggest things to know is no matter which option you go with, you do have to pay that Part B premium. Again, that is $202.90. So you can't get away from that. I always say, if you walk away from this today, you will have to pay that Part B premium no matter what. So Medicare supplements, you will have an additional premium for that. It really depends on your zip code and your state. Prices vary greatly from state to state. So again, you can go ahead and click the one-on-one link below and we can really get that information as to what plans are available in your area. How does the coverage actually work with a Medicare supplement? So Medicare will be your primary insurance. The Medicare supplement will be your secondary insurance. So what does that really mean? That means you can go see any doctor in the country that accepts original Medicare, and that's about 98% of doctors and hospitals across the country. If they accept original Medicare, they will accept your Medicare supplement. It does not matter what company or what carrier your Medicare supplement is with, they will accept it, okay? The coverage, this gives you the lowest out-of-pocket cost when it comes to your Medicare health insurance. And really what I mean by that is it's going to be the most comprehensive coverage when it comes to your Medicare. And we're gonna dive into that a little bit more. Again, a big thing here is when you have Medicare with the supplement, you do need to add an additional prescription drug plan. So you're gonna have 3 different cards, your Medicare card, your supplement card, and your prescription drug plan card. Medicare Advantage, a little bit more about Medicare Advantage here. So again, no matter what, you will have to pay that Part B premium, the $202.90, and then there could be additional premiums for your Medicare Advantage plan. Now, what are some huge differences with this? So with Medicare supplements, remember we have no networks, you don't need referrals, there's no prior authorizations. So when it comes to Medicare Advantage, remember a private insurance company is now managing your Medicare. So what comes with that is you do have networks, there's HMOs versus PPOs. We'll talk a little bit more about that here down the road. And then you do have prior authorizations for more major services. Again, we'll break that down here a little bit later. But the biggest thing is, so now think of it this way, I'm gonna have a lower monthly premium, but I'm gonna have a little bit more out-of-pocket exposure or out-of-pocket risk when it comes to co-pays, co-insurance, things like that. But a nice benefit with Medicare Advantage plans is they do come with additional benefits, things like dental, vision, hearing that original Medicare doesn't have, silver sneakers, or any kind of fitness memberships are super popular now today. Over-the-counter benefits for things like vitamins, minerals, first aid items, anything like that. And again, prescription drug coverage is typically included with your Medicare Advantage plan. So again, on both sides here, Medicare supplements, if I really had to sum this up, Medicare supplements, you will have a higher premium, but you will have much more comprehensive coverage. You have more flexibility, more freedom. And again, you need to make sure you add a separate prescription drug plan there. Medicare Advantage, you're gonna have a lower monthly premium. You do have some networks you have to deal with when you just need to make sure your doctors and hospitals are in those networks. You're gonna get some additional benefits, but a lower monthly premium, you're gonna take on a little bit more risk as it comes to out-of-pocket expenses, co-pays, co-insurance, anything like that. So if you are taking notes, I really wanna make this as simple as possible for you. Medicare supplements over here on the left-hand side, you're gonna have a higher premium, but you will have more comprehensive coverage. You're gonna have more flexibility, more freedom, and remember, you do have to choose an additional prescription drug plan. Medicare Advantage, you will have a lower monthly premium, but with that, you're gonna take on some networks, some prior authorizations, and you're gonna have a little bit more out-of-pocket expenses as it comes to your actual healthcare coverage with co-pays, co-insurance, but you do get some additional benefits there. So one side you pay more but have more comprehensive coverage, one side you pay less and you take on a little bit more risk. One thing that we always like to educate all of our Medicare beneficiaries on is no matter which option that you go with, there will be some major out-of-pocket expenses when it comes to a few things. And the first thing that we always talk about is cancer, heart attack, and stroke, or I call those the big three. Really, no matter what, you will have some out-of-pocket expenses, some non-Medicare approved expenses when it comes to that. And really, it just depends on the diagnosis and the treatment path, so costs can vary for that. But that is definitely something you need to be aware of. And then the second thing, the biggest exposure that we really see when it comes to any sort of Medicare plan is skilled nursing coverage. And really how that works is you do need to have a 3-day inpatient hospital stay. Assuming you follow that, days 1 through 20 are going to be no cost. If you have a Medicare Advantage plan, you may have some co-pays for those first 20 days. And then days 21 through 100, it's $217 per day. And this is the biggest thing to be aware of, is you have no coverage after 100 days. You are responsible for all costs. And this is just for skilled nursing coverage. When it comes to assisted living facilities or any kind of custodial care, there is no coverage for that. So this is what we see as the biggest exposure and the biggest asset eater when it comes to Medicare and your Medicare and retirement coverage. This page right here is in the Medicare and You handbook, page 29. So if you've gotten that delivered already, go ahead and open that thing up to page 29. You're gonna see right here, you do have to have that 3-day inpatient hospital stay. And then the days 1 through 20, days 21 through 100, and you'll see in there, there is no coverage after day 100. And it does say in there is no form of long-term care coverage, any kind of custodial coverage. So it's super important to be educated and be aware of how that works with your Medicare coverage. This is single-handedly the biggest exposure and the biggest asset eater that we see when it comes to your Medicare and retirement coverage. So what we just did was identify the major exposures and some major problems that comes with your Medicare and your Medicare insurance, whether you have a Medicare supplement or a Medicare Advantage plan. So we have a solution, and what that is called is our umbrella coverages. And all this does is it eliminates those major exposures that we just talked about. And if you see here over on the left-hand side, the umbrella number 3, that will be your most comprehensive coverage when it comes to your Medicare options. This is gonna have your Medicare plan with your prescription drug coverage, that when you schedule your one-on-one below, our licensed agents, we have a team of about 20 full-time agents right now. They can help you identify what's gonna be the best Medicare plan, the best prescription drug coverage, and then which umbrella coverage is going to be the best for your specific situation. Over on the left-hand side, you can see that includes cancer, heart attack, and stroke coverage, dental, vision, and hearing insurance, hospital indemnity if you go with a Medicare Advantage plan, and then recovery care is going to be that additional coverage for skilled nursing, assisted living, custodial facilities, any kind of facility coverage there. That's what the umbrella number 3 covers for you. And again, we talk about this in our 64 plus book, where I co-author that with our founder, Chase Gruening, and we go into much more detail on that as well. Make sure to like this video, subscribe to the channel, and leave any Medicare questions you have in the comments below. And if you'd like more help understanding your options, we've included links in the description below to schedule a free one-on-one consultation with a Medicare specialist and get a free copy of our Medicare and Retirement Planning book, 64 plus. Both links are down below in the description. Thanks again for watching, and we'll see you in the next one.